Hey, hi, my name is Becky Campbell. I'm in Meg Lukowski's Adult Health class, Adult Health 1 class, and I'm getting ready to hang a piggyback on a primary line. Okay, so the first thing I'm going to do is I'm going to read my orders, my doctor's orders, and the MAR, and I'm going to read for any allergies that my patient might have. I'm going to learn about the drug that I'm going to add on the piggyback, and it says that we need Rocephin. We need 1 gram daily over 30 minutes. And what I know about Rocephin is that it is a anti-infective medication. It's a 3rd generation cephalosporin, and it treats infections such as pneumonia, that's respiratory, and it treats skin infections and urinary and gynecologic infections too. Well, this guy has pneumonia, so that's what this is going to be treating. So I have to make my calculations. I have Rocephin 1 gram is the order, which is 1,000 milligrams. And so what I need to do is I need to divide that by my 500 milligrams per milliliter, which is what I have available. And then I'll multiply that times 1, and that gives me 2 milliliters. Then I'm going to figure out my drops per minute to set this on. So this adds up or results as 17 drops per minute, and that's what I'm going to set the line for. So I'm going to wash my hands first. Then I'm going to, this is my bottle of Rocephin. I'm going to wipe the top off with a alcohol wipe. I'm going to draw, since my order is 2 milliliters, I'm going to draw 2 milliliters of air. And so I did that. Uncap, inject 2 milliliters of air into my Rocephin bottle. Then I'm going to draw 2 milliliters of Rocephin. Now I'm going to inject this into my mini bag. And first I'm going to uncap, and I'm going to wipe this just to keep asepsis. And I'm going to inject this mini bag very carefully, not to puncture the bag. So I'll inject my Rocephin into this bag, and I'll recap and dispose of the sharps in the sharp spin. In the hospital, we won't be using resharpenable needles. So I have my medicine in here. I'm going to shake it up. I will label it with the time and date, and my initials, the flow rate, the milliliters of Rocephin that's in here, and the drip time, the flow rate, and all that. Next, I'm going to go into my patient's room, and I'm going to identify him. I'm going to ask him his name and his date of birth versus my MAR. I'm going to explain the procedure to him. I'm going to let him know that we're going to give him some Rocephin for his infection, for his pneumonia infection. And I'm going to check the site. Everything looks good. Checking for phlebitis or any pain or infection. And everything's good. And now I'm going to label the tubing that I'm about to use. I have a short tubing. So, okay, I labeled it with the date and the time and my initials. And I have my bag. Now I have my primary bag that I'm now going to clamp. I clamp that.
Now you check it for placement.
And I will inject this, keeping asepsis.
I'm going to listen for air bubbles.
This is clamped. So I'll hang this up here. This is clamped. I'm going to now clamp my primary bag It's clamped.
Have a second nurse come in and verify with
And I'm going to lower it
And also you will measure, see where
and
you
hang it
marked
like
it at.
this.
Yeah, I'm gonna
And
measure
now
it
I'm
too
going
and see
to also,
where I marked it at.
keeping asepsis again, I'm going to
Because
open
it says, listen, measure
an alcohol
the exposed
wipe,
tubing from the nose
wipe both
to
ports,
the end of the tube and compare the base.
and connect
How
them.
much is it coming out or is it staying in place?
Okay.
I'm looking at the tubes.
Now the clamps are locked, so what I need to do is set the flow rate.
and then
Right
I'm
here.
going to put my tape on and then twist it. And
So
then
it says to set the flow rate for the piggyback, for the medication bag, at 17 drops a minute. So I'm going to release, and I'm going to count the 17 drops.
pin this tube down.
Go ahead and do it so they can see it.
I'm letting some of that medication fall in here. Then I'm going to count the drops. 17 drops per minute.
I'm going to
Okay. And now I'm going to come over
make sure
here.
the patient's comfortable, see if they have to go to the bathroom, see if they and then I'm going to hook this up to the
I have checked my Mars and the patient for his allergies, and I've checked the site. He knows what he's getting.
Hygiene.
Oh, okay. And
I'm going to
make
release
sure that the
this clamp,
that I do oral care every 2 to 3 hours.
and now
Patient
the
has
IV is
an
flowing.
IV tube in.
I'm going to check back with my patient. Actually, I'm going to stay here the first 15 minutes in case he reacts to this medication. And I'm going to check him for his 4 Ps, make sure he's in the right position, if he has to go to the bathroom.
Yes, now you just have to say the tube.
I'm going to,
You should leave the tube in there.
instruct him to be careful with the line, not to unplug it if he needs anything to let me know, and give him signs of infection, that it would get irritated at the site, or if he's having troubles breathing or anything. And then I would leave the room and come back and check on him after 15 minutes. And then when the bag is empty, we will come back and unplug it and reset the primary bag.